Chronic kidney disease, by definition, is defined as a permanent, progressive, and irreversible deterioration of kidney function or urinary abnormalities found in the urine, for example, leakage of protein, which we know as proteinuria, or presence of RBCs, hematuria, or presence of pus cells, which we call as pyuria. And it usually extends for a time duration of more than 3 months. So if any patient has a problem either in the urine or is detected to have deranged kidney function test like a high urea and a high creatinine, and that problem persists for a period of more than 3 months, then it comes under the definition of chronic kidney disease. So which means that some damage has already happened to the kidney in lay terms and layman terms, and it is likely to progress. So a degree of permanent damage has happened, and it is essential at this moment of time, at the earliest, I would suggest to present to a nephrologist or a kidney disease specialist, so that at least try to delay the progression of the disease or try to halt or alter it as soon as possible. Chronic kidney disease has been defined as having 5 stages, from CKD stage 1 to CKD stage 5, whereas the stage 1 has a GFR of more than 90 ml per minute per meter square, and the final stage has a GFR of less than 15 ml per meter square. So it is divided as CKD stage 4 is 60 to 90, then CKD stage 3 is 30 to 59, and then from 15 to 29 would be CKD stage 4, and less than 15 would be CKD stage 5. And the most significant and the most damaging or the traumatic stage is the CKD stage 5, because when the function of the kidney goes below 15 ml per minute per meter square, that is the glomerular filtration rate or the kidney function in layman terms, then one is a candidate to initiate dialysis, because the patient starts to have those symptoms of nausea, vomiting, easy fatigability, weakness, and breathlessness, and fluid overload, that is swelling around the eyes and around the legs. So when you progress from CKD stage 1 to CKD stage 5, that time of progression depends upon what stage you present to your nephrologist, and what is the treatment that you undertake, and how strictly you control your sugar, blood pressure, and diet. And along with that, go on taking your medication. So try to increase this progression of stages from few months to few years. Chronic kidney disease is actually a disease which in the early stages of the disease or moderate stage of the disease doesn't present with very specific symptoms. So that is why kidney disease is known as a silent killer. Silent killer in the sense that the manifestations, the clinical manifestations, they present when the person reaches the last stage or the end stage of the kidney disease. So in early stages, the symptoms would be the patient has mild nausea, has, this change in urinary frequency. For example, he starts to go for urination more often in the night, and initially he was not going for urination. He develops weakness, he develops decreased in appetite, he develops easy fatigability. Then there might be a symptom of pain where the kidney is located in the body. For example, the upper back area just below the ribs. So he could be having pain there, or could be having pain in the lower abdomen as well. There could be symptoms such as breathlessness. Two important symptoms which the viewers should realize in a chronic kidney disease are, which you should always, keep alert of, is low hemoglobin, that is anemia, and high blood pressure, that is hypertension. So if a newly diagnosed patient suddenly develops low hemoglobin or has anemia without any cause of any, blood loss from the body, which he or she has seen, then, and it is persisting, then one should be alerted to the fact that it could mean that his kidney functions are being altered, and he's or she is in the process of acquiring a chronic kidney disease. And the same thing is with the hypertension. If you are found to have hypertension, you will be surprised to know that the percentage of people with hypertension that have kidney disease is even more than a cardiac disease. So usually people go to a cardiologist for hypertension, but commonly speaking, even kidney disease can lead to hypertension, and more commonly as compared to cardiac disease. Other than that, when the symptoms progress, then the patient has frank vomiting, multiple episodes of vomiting is there. One can have swelling around the eyes. One can have swelling in the lower legs, which can be detected and called as pedal edema or pitting edema. Then apart from that, there is itching. You can have dryness of skin. Obviously, breathlessness, as I mentioned, is a factor. And along with that, hypertension and low hemoglobin, anemia. So if you're found to have all these symptoms and you tend not to eat food, refuse food, are becoming extremely weak, losing weight, then you should or get yourself evaluated by getting your kidney function test done and getting your urine test done, and even an ultrasound of the imaging of the abdomen to have a look at the size of the kidney, ureter, and bladder. A world where diabetes, hypertension is rising at the moment. So diabetes, hypertension also affects the kidney very badly, and it leads to the complication of chronic kidney disease or CKD. So the most common cause of chronic kidney disease worldwide is diabetic nephropathy or secondary to uncontrolled blood sugars or diabetes. Then hypertension is another important cause. Then we have certain causes with unknown etiology, for example, chronic glomerulonephritis or chronic tubulointerstitial disorders, which can affect the kidney and cause a progressive deterioration in renal function. Other than that, we have other diseases, for example, recurrent urinary tract infections that can damage the kidney. Then we have stone formation, which can affect the kidney and can cause damage to the kidney. Then there are other toxins or wrong drugs or alternative medications, which taken for a long period of time, including painkillers, can lead to kidney damage. And there are certain genetic factors. And then also there is a class of chronic kidney disease that is caused by obstructive pathologies. For example, when the prostate size is enlarged and it remains enlarged for a large period of time, there are stones which are causing obstruction to urine, and it goes untreated or undetected, that can lead to chronic kidney disease. So it is caused by a wide variety of factors. It is very important to first be on the lookout for symptoms. I've already mentioned the symptoms before. So if you're having weakness, nausea, vomiting, decreased appetite, be on the lookout and go to a nephrologist and get the following tests done. Get your blood tests, which definitely involve a kidney function test and a hemoglobin, so that you can detect anemia with your hemoglobin, and kidney function test to see the levels of urea and creatinine. So for a normal person under the age of 60, the creatinine level should be less than 1. If they are elevated above 1, then a bell should be ringing in the head and saying something is wrong. And serum creatinine is the single most important predictor of kidney disease. Apart from that, early damage in the kidney in the case of chronic kidney disease can be detected by urine investigations. For example, urine routine microscopy or a spot urine protein by creatinine ratio, which will help in diagnosing any protein leakage. So protein leakage is the earliest manifestation of kidney damage, and it especially happens in diabetics. So diabetics should be especially wary of this. Along with that, get an imaging study of the kidney done. One of the hallmarks of chronic kidney disease as it progresses and reaches the final stages, that the kidney size starts to shrink in most of the diseases. So try to see what the size of the kidney is. Normally, kidneys are from 9 to 10, or in some cases up to 11 centimeters in size. And if the size goes below 8.5 centimeters, then one must realize that the problem which is causing the chronic kidney disease has been going on for some time and it has been undetected or untreated. So with imaging investigations, urine investigations, and blood investigations, we can easily diagnose a kidney disease. Once you have entered early or middle stage or moderate stage of CKD, there is always going to be a progression. So it can never be halted or stopped completely, but the progression of the disease can be delayed. So how to delay the progression? If it is due to diabetes, control your blood sugars. Control your blood pressures if it is due to hypertension or the blood pressures are uncontrolled. Watch out for your weight. So obesity is another factor that can cause progression. Get your renal parameters tested depending upon your nephrologist, that how often you have to get them tested depending on the stage of kidney disease you are in, and take the medication prescribed by the nephrologist in order to control the various metabolic abnormalities like acid production in the body, calcium levels, phosphorus levels, and so on. Apart from that, be on the lookout and maintain the fluid and electrolyte balance. Sodium, potassium levels are extremely important. The amount of fluid that needs to be taken, or whether you need to clear the excess fluid from the body. For that, the various medications that need to be taken will also be prescribed by your nephrologist, and follow a very conservative diet. So I can broadly tell you that a person who reaches a chronic kidney disease stage, whether it is 2, 3, 4, 5, before progressing to end stage, which is known as CKD stage 5, and a patient requires dialysis, you should have a salt-restricted diet broadly. Water intake has to be decided on the basis of your urine output. If it is less, then it has to be between 1 to 1.5 liters. If the urine is still coming, then you can take more than that, to 2.5 liters. Also, potassium has to be restricted. Try to avoid foods which have potassium. For example, fruits should be avoided other than apple, pear, guava, which have less of potassium and can be taken. Avoid potatoes, tomatoes, avoid coconut water, avoid amla, achar, chutney, and so on. avoid phosphorus-rich compounds, and during the process of pathogenesis of this kidney disease, protein leakage is a very important, predictor of progression of the kidney disease. Higher the protein leakage, faster will be the rate of progression of kidney disease. Control your protein intake. If a normal individual is supposed to have 1 gram per kg of protein per day, then a patient in chronic kidney disease should suffice 0.7, 0.8 or 0.6 depending upon the stage of kidney disease you are in. So watch your diet very carefully, meet a dietitian and discuss the exact diet plan. And if you do all these things and control, don't take any other painkillers or alternative medication and follow your doctor's advice and be regular checkup, you can safely increase the period of life for progression of chronic kidney disease from stage 1 to the final stage, which require dialysis or kidney transplant. Chronic kidney disease has various complications, and these complications usually manifest when the person reaches the last stage of kidney disease. So, for example, in an advanced stage of kidney disease, CKD stage 5, which has gone on to be undetected or just been diagnosed, a patient can have seizures, patient can present with coma, that is loss of consciousness due to the high levels of urea and creatinine in the body. You can have fluid overload, which means there is accumulation of fluid and salt retention in the body, which leads to swelling in the eyes. And in severe cases, it leads to accumulation of fluid in the lungs, which can present with bleeding from the mouth in the cough. Also, patient can have severe episodes of nausea and vomiting. Patient can have severe itching, and such kind of patients often present with a very bad smell or odor, which we call as a uremic odor, which can be smelled, can emanate even at a distance of 5 to 6 feet. You can feel that smell of toxicity that is coming out of the patient. So it can present from central nervous system complications to complications of even heart attack, because in kidney disease, the risk of having heart attacks is many-fold, up to 20 times that of a normal person of a similar age with similar comorbidities. And it can affect the abdomen with nausea, vomiting, and it can affect the nerves as well, causing weakness of all nerves, leading to numbness and tingling and so on. Take less of salt. Your water intake should be less and should be determined by your urine output. Avoid substances containing potassium and phosphorus. Try to take a low protein diet ranging from 0.7 to 0.8 gram per kg body weight of protein intake in a day. Control your weight, control your blood sugar levels, control your high blood pressures. Avoid intake of any painkillers, avoid intake of any alternative medication. Get your kidney function tests done regularly. Meet your doctor. Meet your treating physician or nephrologist. Try to present to a nephrologist or a kidney specialist as early as possible, earlier the stage at which you present to a person who has chronic kidney disease, and at earlier stage you present, more are the chances that your progression of kidney disease could be delayed and the ultimate complication of CKD stage 5D can be prevented, where the patient can, avoid dialysis. Also, one should recognize that even if you have progressed to CKD stage 5D, we have kidney transplant, which is the most, best form of treatment for a patient with kidney failure, where as in a donor donates one of his kidneys to the patient after a sequential number of tests and matching and cross-matching, and has normal kidney output and kidney functions post that. So the donor lives a normal life, the patient after the transplant lives a normal life, and he's rid of dialysis, and his kidney usually functions, up to 10 to 20 years, which we take as the normal half-life for a post-renal transplant kidney. So there is always hope in kidney disease. Try to prevent it, try to delay the progression, report to a nephrologist, and even if you develop this disease, don't feel bad, don't feel sad. No one dies of kidney failure. It is either cardiovascular complications or infections which can lead to damage. And we have kidney transplant which can make you lead a normal life again, even after kidney failure.